All right. Hi, everybody. Welcome to Needles and Nonsense.
Hi.
We're back this week with April. And April is one of our injectors at Elevate. This is actually our newest injector to the team, but it's been a year. I mean, it's coming up.
Almost been a year, right?
Yeah. Was it
in March?
I feel like it was April. I was going to say we hired April in April.
Not quite, but March.
Yeah, March. Yeah. So literally coming up on a year now.
It's crazy. I can't believe it's been that long.
I know. And you're loving it. We love you.
Yeah, so it's great. I'm very happy. I mean, it was a long time to get here, so yeah, I'm happy to be here.
Yeah. Good. Okay. Well, I know that you have talked a lot about your journey in the aesthetic world, even before it, how you got here on your platform on TikTok.
Yeah.
I would love to have you share a little bit of it here and just kind of tell us.
Yeah, totally.
Yeah. Just start from beginning to end.
Oh, at it.
Where you ended up.
Well, I went to nurse practitioner school here. I went to the University of Tampa and I graduated. I started in prime COVID time. So it was 2020 and I started making TikToks, which was so weird back then. I didn't want anybody to know. 2020. Yeah, when people were dancing on TikTok. It wasn't me, but
it started with the dancing.
Yes.
Videos when everyone was bored.
Yes.
At home. Oh my gosh, wow. Okay, yeah, I didn't realize that.
And I think I just started making random things. But it was in the prime of my nurse practitioner school because we had just I was going in person, I was working in person, and then I was working as an elective surgery nurse. And so we stopped doing elective procedures. And so I started working way less, and my nurse practitioner school classes went to online. So I had way too much time on my hands and just started experimenting, with TikTok. And I just kind of grew. I wouldn't say it grew overnight, honestly. It took a long time. I have never been somebody who has things happen to me overnight, but it took a long time.
You got to dedicate and put the work.
Yeah.
I wish that rewarding. I feel in the long run, if it's success, then
I know you're right.
It feels it can also go away as quick as it started.
I actually agree. Yeah, it's been a slow burn, but it's good.
What was your first video ever? Do you remember?
Yeah, actually, I do.
Pop up of it.
I don't know. I'd have to find it, but I'm pretty sure it was my husband Seth and I. We were taking a walk, and I literally just filmed us taking the walk, and my dogs on the walk, and flowers on the walk. And that's really it. I think it was something really stupid.
So you weren't even talking?
No.
This is what I'm doing in the moment.
Right? Yeah. Okay. I don't think I talked to the camera for probably 6 months. I didn't want people
into it.
Yeah. No. It was when Instagram started back in the early 2010s.
Yeah. It was your email and a huge filter over it and a list really graphic.
Exactly. No, there definitely is a huge filter over that video. It's really saturated, but yeah, that was my first video. And then I think I just kind of tried to figure out what would work, and a lot of my and a lot of my nurse practitioner stuff really started taking off, so I just kind of ran with that. And by the time I had graduated nurse practitioner school, I was kind of what am I going to do? I always wanted to be in aesthetics, but as you know, it's really hard to get into the aesthetic field. It's just really competitive. It's all about who you know, and you need to have experience. So
you knew though early on that you wanted to be in aesthetics.
I feel I had it in the back of my mind that I wanted to be in aesthetics.
So I always want to get there at some point.
Yeah. I didn't want to put pressure on it though, because I didn't have experience injecting as a nurse. Obviously in the state of Florida, you can't do that. And I was kind of new to the Tampa area. I moved to Tampa in 2019. So I hadn't been here for very long. I didn't know that many people. So it was always I would love to do that, but I don't know if it's going to happen type of thing.
Okay.
So I actually started working in primary care, and my primary care office, my friend got me that job. My primary care office also had a little med spa that they were trying to get going. And I didn't want to touch that for months because I was also learning how to do primary care. I was learning how to be a new grad nurse practitioner. I had some math about it.
Really slow to you. Yes. In your main master 1, 3, and 4, I take on another, which is so smart though.
Yeah, I think sometimes it probably holds me back a little bit, but I'm very much I want to perfect something before I move on to something else. So I felt I wanted to perfect, if you will, primary care before I went into injecting. So I did about 6 months of just primary care only. And then I was okay, I will maybe do a few people here and there. And I really just kind of we had nurse practitioner students who would come through our office, and my boss would give them Botox at unit price, however much you could buy it for, which was, I don't know, maybe $4.99 or something. And I would just inject them for the unit price and kind of learn how to do it from there. It was perfect.
Yeah. Oh, can I get placement?
I know. And we had so many students. So actually it was great. And then I started doing it on commercially insured patients. And by that time, I was kind of getting burnt out of primary care, which happened so quickly. I was seeing 25 patients a day. And, these patients have so many issues, diabetes and high blood pressure and all these things that you're trying to control in like a 15-minute visit. And I felt like I saw that as my window. I was like, if I want to get out of this, I need to pivot now. So I actually just kind of randomly found like a independent contracting job on Indeed, and they hired me with the minimal amount of experience that I had and put me through like a cadaver lab training and just kind of let me inject
immersion.
Right. Do all these types of things. And that's really where I got, I would say, the bulk of my experience before Elevate. And then I got Elevate, which is exciting.
Yeah, they're all like little stepping stones, right, to get somewhere.
Yeah.
You want to be, and you take like a little bit from each position, but totally at that primary care practice, and then having that little bit of like med spa experience. Did they take off with it, like, or did it? And
I don't think it really ever, I don't think it ever really took off for them. I don't really keep in contact with them anymore, but I know like when I was there, I was maybe seeing like 4 or 5 Botox patients throughout the day, which was nice. And I would see them like on my lunch break. Yeah. It wasn't, they wouldn't let me see them like during the day.
Yeah. Take away from the primary care.
Exactly.
But I do feel like that's something that we come across a lot in this industry is like everybody wanting to dabble in aesthetics. So you'll have like the dentist offices, in Botox or like in primary care. I've even heard like women's like groups like
I think gynecologists will do it.
And the way I feel about that is like you don't see me doing like dental on the side and like apps me right at like on my lunch break and stuff. And not that we're not capable. Well, the dentist stuff we're probably not capable. So we didn't go to dental school. But the past years, like we were all clinically trained to do that kind of stuff. And I don't know. I feel like if you just stay in your lane and you can just focus on the things that you can become an expert at and like perfect your craft, like that's where you should be. And it's hard to try to juggle so many things at once.
Yeah. Well, I think that's the importance of just like going to a specific med spa or, a specific, cosmetic dermatology clinic, because you're going to get somebody who do that. Yeah, that's all they do.
Their sole
job.
And
I'm so grateful for all the things that I did to like get where I am. But if it were me as a patient, I'd be going to a place like Elevate to get my Botox, not, my gynecologist's office, even though they might do a great job.
They could. It's like not knocking them. It's just kind of like our experience being on both sides. Like we're just speaking from the experience that we've had.
Yeah. If you just do that all day, you're going to be better at it.
So now I guess like a question that a lot of people would have is like going from primary care and doing like medical type, procedures daily to more of a cosmetic type of approach. Like people could judge you for that and say like, they love to be like, wow, how is this, medical based?
Yeah.
What are your thoughts on that?
I just honestly, I think that's like haters. Like you're jealous. So you could do this. Yeah. But I do think that like the medicine side really prepared me for cosmetics. But
I think that's a misconception in this industry, is that what we do is just like fun and like very light. It's not like that's serious. And obviously we're not dealing with life and death, but like it is a medical procedure.
Yeah.
And it's like
these are meditations.
It's not like a sterile technique. We have to think about like all sorts of things going into it. We have to have a really like thorough medical history because there's a lot of interactions that can happen.
Yeah.
So at the end of the day, we are practicing medicine. Like it might be.
It's a different form of medicine. Yeah, that's true. That's a good point. We have to know anatomy. We have to know medical history. We have to diagnose and we have to treat. We're just not diagnosing and treating traditionally.
Exactly.
Like we're using a certain amount of units, a certain amount of filler because of our expertise and like what we see in the face. So it's a good transition, but obviously that's not something that we learn in school. It's something that you really have to perfect.
Yeah. Okay, well, we're going to kind of get into a little clinical stuff today, just because we have like, 2 nurse practitioners here, and I figured why not bring up like one of the biggest hot topics right now. So I know there's a lot of stuff going on in the media. I don't even know if I actually feel like it is trickling down to the consumer, like the client. But a lot of times we have this stuff on our pages, like we all feel like we're only seeing it. But the PDGF is like something that's become really controversial right now, right?
Yeah.
Well, PDGF stands for platelet derived growth factors. It's definitely on that like regenerative side of where aesthetics is going. It's all about like stimulating collagen, stimulating new tissue growth.
Yeah.
It's not a filler, but there is a lot of controversy with it for like really 2 reasons. The main one that we'll kind of just dive into is the fact that people are saying it's, not approved for injections or not approved for microneedling. The really only like approved application of it is topically, which would truly be like using it as like a face serum, just rubbing it on your face at night.
which we don't know if it would do much because it's not getting into the.
Yes, right. It's not getting it. So PDGF is a messenger, right? Like it sends a message to the cells in your body to grow new tissue. And that's why it's considered a growth factor. And that's the purpose of it. So you kind of do want to put it into an area that you directly want to grow tissue. And
Right.
so we, love to put it under the eyes for people because that's something that has never really been a great place to add filler. It can to have just a ton of side effects. Also, just have like
an under eye filler has gotten like a bad rap again in our society. So it's a nice little alternative for people who don't want to do under eye filler.
Yeah. And I feel like for us, it's been huge for our practice because we do inject it still. And we've had really good results with it. We, inject it like smartly. We use our own discretion. But yes, as nurse practitioners, we feel like that's something that that's the reason why there's your master's in nursing versus nursing. As a practitioner, you're able to make these judgment calls. Not just having to take an order from a physician, which is how nursing works. And, in the hospital, you take an order and you just kind of carry out those orders. Well, now we're the ones actually making the orders. And I feel like having that autonomy is also knowing when we can inject a product that might not be FDA approved for injection. Yeah. And it doesn't. And just because it's not FDA approved for injection doesn't mean it's not only doing.
Yeah, exactly.
It's not like they're saying, okay, we've tested this product, we've tried it out for injection, and we decided no, you cannot inject. And they haven't gone through the testing yet to get to the point. Yeah. It's experimental, it's new, and takes rigorous clinical trials to get an FDA clearance, and they just haven't had the time and the money and the things that they need to do to get there.
Yeah. I just think
what is you would say about that?
Yeah. I just think because something's new doesn't mean it's bad. And I feel like a lot of the fear mongering is coming from practitioners who are being so black and white about it. They're like, no, never do this.
Right.
Or another practice could be like, yeah, we do it all the time. And I think we kind of live in that gray area where it's like, yeah, we're going to make educated decisions based on our patients and based on their tissues and their needs, how we inject it. And I think that's the beauty of, like you said, being a practitioner is I get to make that judgment call when I feel comfortable, and our patients trust us to make that judgment call.
Yeah.
So I feel good about it.
And we're making safe judgment calls. Not just putting into anybody out the door. They're going through screening. We're having, a huge conversation with them about its experimental nature. And this is something that is newer, right?
Yeah.
But, I think when you just do a simple risk, benefit, evaluation, you see that a lot of the benefits outweigh the risk.
Yeah.
Really not a ton of risk associated with it. But it's a little bit of redness, bruising, things that are all common with any sort of injectable procedure that we do.
Yeah.
There's, it's been a little bit of controversy as well as how is this affecting cancer occurrences, right? Is it accelerating the growth of cancer because technically it's a growth factor? It means that we're trying to, just because we're growing new tissue cells, are we also going to be growing cancer cells? What would you say about that?
I just think that honestly, again, we just have to use it to the best of our knowledge. I don't know if a cancer is there if you're not diagnosed. Yes, I'm always reviewing your medical history, but I would hate for you to have a cancer, but you could have cancer sitting in front of me.
Common,
exactly. I think it's 30 to 40% of maybe, I don't know if it was the world or the United States, will likely have cancer in their life. Yeah. And unfortunately, I can't put you through a PET scan before I do one procedure on you. And that's medicine, whether you are practicing aesthetic medicine or practicing primary care. I don't know for sure that you are allergic to a medication before I give it to you, but I'm going to talk to you about what to do if you are allergic to it, So again, risk versus benefits, talking to your patients. I have had patients that I've had conversations with them about PDGF and they've decided not to do it. That's totally fine. That's their prerogative.
I'm sure that they are educated enough to make the decision at the end of the day. We're never going to push anything on somebody. And if they feel strongly enough that this, it's not even a risk, but that this maybe idea or the stuff that's out there about, cancer acceleration is just, they're not comfortable with that, then
don't do it by all means. Yeah.
I think you have to feel totally comfortable with it. I mean, I know even there's been something lately and that we've been seeing across Instagram and just some of the platforms that we have other injectors on that are pretty popular. And they've been talking a lot about how now there's this risk of anaphylaxis with a GLP-1 medication, which are semaglutide, tirzepatide, Ozempic, just some of the big names out there. And they're saying that every single client should be given or prescribed an EpiPen if they're on this medication, which is
crazy.
Right now, I think it's I don't even know what the percentage of population is on these medications, but
I don't know exact, but I would say it's at least 50%. Obviously, probably it's probably not or something. We're so crazy, but it's still a large number of people than before when it was only a diabetic indication, and now that it does have the weight loss indication. I mean, what do you think about that? I think that's insane. Just think that.
And having coming from a primary care office where you actually like dealt with the patient like a lot.
I think that the people are saying that essentially if you switch a patient from semaglutide to tirzepatide, that anaphylactic risk could go up. And to that, I would say, like, what if you had a patient on a beta blocker and you switched them because they were like had asthma, so you wanted to switch them to like a more specific beta blocker? I'm not going to give them an EpiPen for any prescription unless I know for a fact that like they're going to have anaphylactic.
Exactly. Because you get allergic to anything that you take medication wise. No.
Yeah.
I mean, I think educating on people the signs of like what a severe anaphylactic experience looks like, so they know to call 911. But just like hoping that they'll use their EpiPen is also that's putting a lot of like the risk in their hands.
Yeah. I also think it's unrealistic to ask a patient to pick up an EpiPen, and just have it on them just in case they might be allergic.
Insurance,
they're like $600, I think.
So most people won't feel it anyway.
Exactly.
So you're sending out like a empty script that no one's going to see that, right? I just think for that to me is fear mongering, right? Like it's just saying, right, let's obsess over this one situation that, the percentage and likelihood is so small, but let's go overhead and over prepare for it. And there's nothing wrong for being prepared.
Right.
Or do like the first dose in office with them, and then you can monitor them for a good, 10-15 minutes and then just see how they're feeling. Yeah, that right there is going to like mitigate most of your like chance of even having an anaphylactic. Yeah. It's going to happen, pretty immediately.
Yeah, I agree. I agree. I don't think that you can send an EpiPen for everybody who switches or tries a new medication. It's unrealistic, whether you are working in the med spa setting or a traditional medical setting. Everybody in the world would have an EpiPen. It's just not. It's not what's going on.
Yeah, I agree. So, I mean, I think with the PDGF overall, I would say that there's some things out there that a lot of people could be feeling a little bit misunderstood about, and we're here to like clear the air. You can always like talk to us as providers. We're still injecting, and it's not because I want to like flag us and be like, oh my God, somebody come find us or write us, because right now it's so crazy out there, and they're like, if you know someone who's injecting and you need to tell on them. It's like, I'm actually, our practice like in general is not one to pick up things that we don't really know a lot about. Yeah, I'm not like, let's jump on this shiny bandwagon.
Yeah, we don't jump on trends.
Yeah, with the newest, the latest gadget and talks or whatever it is. So I really actually feel like even with PDGF, like I gave it a solid 6 months when it was in like the aesthetic world, and just like kind of listened to his colleagues. And once I realized that worst things they were seeing was a little bit of redness and swelling and bruising and, that kind of stuff, that it seemed like we could take that on as a practice. And luckily for us, like we've only seen really good things. We've had a lot of good experience with it.
I also always tell my patients who want to do it, like, if they're concerned, if they're like, would you do it? I'm like, yeah, I have done it. So I would never do something to you that I would never do to myself. So I've done it.
I mean, I would say majority of the people in our like that providers front desk, I have done PDGF in one sensible way, whether it's
I've done it topically, I've done it injectable.
And that's huge, right? Like we are smart. Like we're not going to put something in our body that we feel like is going to cause cancer or cause the acceleration of cancer or whatever. If it's unsafe or harmful in any way, and if we're doing it, then and the same thing goes with like peptides. Like peptides have the same risk. Like they all mimic like HGH, which is like human growth hormone, and that's exactly what the point of them is to your body to build new cells that are good for you. But you could have that same exact argument that could be accelerating cancer somewhere. It's all just about screening and
exactly. I just think as a society we need to understand that when things are new, like there's going to be a lot of controversy, but that doesn't mean that it's bad. Controversy doesn't equal bad. It just means that we're learning, we're growing, and I think the aesthetic field is really pushing towards regenerative medicine, which I think is super cool, and we just have to give it time to like get the research to back it.
It does. Okay, well, enough about the like nitty-gritty clinical stuff. I wanted to ask you, because I feel like you're so like up on the trends and all like the fun stuff. Yeah, let's hear it. Maybe I'm a pro. Yeah. Okay, and you're obviously younger than me, so that helps. Okay, what are your ins and outs for 2026 when it comes to aesthetics?
I think, honestly, my biggest ends is probably something that everybody's saying, but full face talks. I love full face talks. I just think it's going to make such a difference in overall how people age. I feel like you can look at somebody nowadays who has been doing talks for 20 years just to their upper face, and you can feel like, okay, their upper face looks great, but the lower face is not matching. And I feel like the push towards full face talks is really going to like make my generation age really beautifully, which I'm excited for. So huge proponent of full face talks. I think, honestly, I'm really into regenerative medicine, like lasers, PDGF, Sculptra. I think getting ahead of aging is where we should be going in the aesthetic field rather than trying to chase like volume loss, getting ahead of it. So
yeah, preventing it, right?
exactly.
And I think because you're seeing a lot of trends of the younger people coming in,
Yeah.
and the younger people don't need so much corrective
Treat
procedures. Yeah, they need more like preventative. So that we're just doing more of those Sculptra and collagen stimulation.
Yeah, I feel like I'm seeing a lot of patients my age, like late 20s, early 30s, and I love that we're getting ahead of that aging process. So it's nice to be like at the same place as them. So Sculptra is definitely a big in for me right now. Full face talks, and
out that you would say.
I feel like the typical things that are out, like overfilling.
Yeah.
I feel like I'm kind of, this is like so niche, but I feel like I'm kind of over like a big lateral cheekbone. I don't know why, but I feel like sometimes maybe they're just going too much.
We were taught, I feel like as injectors, you always heard like, don't fill the nasolabial, fill the cheeks. And then that was sold to us so much that it 100% trickled down to the patients, because people come in all the time and they say, like, I really hate these. I know if you put a little filler here, it'll like dense it up. And I'm like, I wish, but it's really not that easy. Like, all right, put a little bit of filler here. This is what will happen. Like, you'll have a nice contour and a nice cheekbone, but you know, might not necessarily take all the weight off. Yeah, I mean, like that's that would be a lot of pulling.
Yeah, I like a little bit, but I definitely think it can go too far these days. But yeah, I feel like just overfilling and being just a little bit
overfilling, just an area, like, right? Like, as like you're overfilling your whole face, but maybe you're only doing like your lips and you're only doing then it's like, you're forgetting that
that's a symmetry, like full face. Yeah, I think
looking weak compared to the area that you've enhanced.
I agree. Yeah, I think I'm just one of my outs would be people come and sit in my chair, and I'm sure your chair, every day, and they're like, this one little thing bothers me, and it could be like a dent right here, and I'm like, no, but I'm trained to do this. I didn't see that until you brought it out. So it's really
helping them like understand,
like balance. Like, I feel like we need to be looking at the face as a whole. That's one of my biggest 2026 is not filling specific areas, maybe just bringing balance to the face and looking at everything as a whole. I feel like so many people are terrified of filler, and I understand it to a certain degree, but when filler is placed professionally and like thoughtfully, it really does give like the most beautiful result. And that's how you're gonna get the most natural result, is actually treating multiple areas and not just spot treating places. Those are like my ins and outs.
I think that has to do with like us not being order takers versus just being like, okay, let us tell you what you need.
Yeah.
I mean, we're here to listen to you. Like, I hear all your concerns, and I want to know what bothers you, but I'm not just gonna be like, have you come in and say, I want the cheeks or I want the lips, and it's like,
they'll be like, okay,
here you go.
Yeah, because you're probably not gonna like the results.
Exactly. Yeah. So that's like where a lot of people probably, I would love to hear that, but then there's some people that might be taken aback with that. I'm like, I don't know. Like, I just want to be able to go to somebody who does what I want them to do. And it's not that we don't want to do what they want. We just want to give them the best result, which is taking into account the entire face and not just one little area.
I think it's having that relationship too, where you can sit down and you can tell me what bothers you, and then I can tell you how we can enhance that. But also being open to my suggestions. Like, I trust you, and I know that I'm not going to overfill you or make you look unnatural type of thing. So
it helps when we don't look like overfillers.
Exactly. I think that's the biggest thing that I get from patients is like, I trust what you're going to do because I know you don't look crazy.
Yeah.
That's great.
Yeah, like a really good testament to all we inject is like, I think the way like we're our own like walking billboard.
Yeah, absolutely.
Well, that was so fun.
Yeah. Thanks for having me.
Cheers. I know. I enjoyed it a lot. I mean, we got to dive into some great topics.
Yeah.
So
yeah.
come.
Yeah.